There we go. And then I'll give it to Lori. So take it away, Lori.
Thanks, Whitney. I appreciate it. Okay, I'm going to go ahead and start with our surveillance report. All right, so this is our surveillance report for January 21st. And as you can see by this first figure, let me get that a little bit bigger again. This describes, again, the number of daily cases in a 7-day rolling average of cases per 100,000 residents in Gallatin County. These blue bars, again, indicate those case numbers, daily case reports per 100,000, and then this orange line represents the 7-day rolling average. And what I wanted to point out here is this looks like appears to be a downward or a decline in the number of cases that we're experiencing. It's too early for us to tell whether or not this trend will continue. But I want to also reiterate how important it is to understand that right now we are experiencing very high community transmission, and we're really seeing case numbers that have been active case numbers that are the highest we've seen throughout this pandemic. So while I said that it appears that we're seeing a decline, it's too early to tell if this trend will continue. And I want to continue to urge caution in the community as it relates to taking all those precautionary measures, like wearing a mask in indoor public places, staying home when you're sick and getting tested. We still have a lot of active disease in our community. The second figure here is our 7-day average % positive rate. You can see that when we looked at our 7-day rolling average of % positive from the previous week to this week, it's stayed pretty much the same, right around 32%. So we are seeing a bit of a leveling off in our % positivity. Again, this is the highest positivity rate that we've seen, of course, over the last several months as well. Median time from specimen collection to report to public health continues to be a median of 1 day, which is great. Good turnaround time. We want to see that and can see that continue. And this is COVID-19 cases by vaccination status. Again, we continue to experience breakthrough cases, and that's not unexpected. And we've talked about this before, and I share this with the community. No vaccine is perfect. And really, when we're talking about these types of infections and these breakthrough cases, again, it's not unexpected. And there's likely, as we shared before too, more disease happening in the community than we are able to capture. So I just want to remind folks that the vaccine continues to be an incredibly helpful and useful tool, especially when we're talking about hospitalizations and severe disease and severe outcomes, which I'll share here in a second down in this figure. So in terms of the number of hospitalized COVID-19 cases, these are for Gallatin County residents that were hospitalized. I just want to indicate that we see more of the individuals who are unvaccinated are being hospitalized. So again, like I said before, vaccinations, your primary series followed by your booster dose when you're eligible continues to be an effective tool as we move throughout this pandemic. Moving to our vaccination rates. We changed things up a little bit, so I wanted to share with you, this is a fully vaccinated table. We've been sharing this with all of you all along, but as you can see, we have these bolded numbers indicate a 1% increase in these particular age ranges. So we saw 1%, at least a 1% increase in the 5 to 11-year-olds, which is great. We want to continue to see that. And then again, in some of our other age ranges as well. And then we added this figure. I shared this, it was last week, we shared this figure, which just describes the residents, vaccine doses received by Gallatin County residents. Again, this is broken down by MMWR week. So it's done by both the first dose, so you can see the individuals who are receiving the count of individuals receiving a first dose, The orange bar indicates our second dose, and then the green is our booster doses or third doses. So we wanted to share this with the community in terms of what we're seeing in terms of uptake for both the primary series as well as that booster dose as well. We updated this table last week, and so I'm sharing this again with you in terms of number of active cases broken down by age group. We added in the 0 to 4. We did not include that in last week's, and after some internal conversations, felt it was really important to also break that down so you can see the number of active cases by age groups. And again, we look at it one way that we can compare this equally is looking at it by active cases per 100,000. And you can see here that this particular age range basically are 12 to 49-year-olds really have the highest number of active cases per 100,000. Followed right behind that is our 50 to 59-year-old age range. And then, as I stated from the very start, we are experiencing very high transmission in our community. So as I have shared, and I will continue to share with our community, the importance of precautionary measures, which includes wearing a mask in indoor public places when we're experiencing this high transmission. And that, again, is regardless of your vaccination status. So with that, I'm going to stop sharing and hand it over to Kallie if she has any updates she'd like to share.
Excellent. Thanks so much, Lori. So we currently have 17 COVID-19 positive patients at Deaconess Hospital. We do not have any at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds, as I typically state, and it's currently at 85% capacity. 3 of the 18 in the critical care unit are COVID-19 positive. Additionally, our medical unit is at 85% capacity as of this morning at 6 a.m. And our surgical unit was at 64% capacity. Our testing numbers, however, continue to increase. Last week, we processed over 5,000 swabs for COVID-19 tests. As of 11:30 this morning, this past week so far, we have processed almost 3,000 swabs for COVID-19 testing. These numbers include our testing sites at Deaconess Hospital, Big Sky Medical Center, Belgrade Clinic, and our B2 Urgent Care location on Main Street. We appreciate your patience and understanding as we are experiencing these extraordinarily high testing volumes. And we also continue to work through staffing shortages, so a big challenge all around. But while staffing shortages are not currently affecting typical services, we do want to let the public know that patients may experience longer wait times when calling a Bozeman Health Care site or visiting a testing site. Again, I cannot stress enough that we appreciate your patience and your understanding. I also want to remind folks that are established as patients of ours, their testing results for swabs collected at a Bozeman Health Care site are available via their MyChart account. If you have any questions on testing or vaccines, you can call our COVID-19 hotline at 406-414-2619, and our team will be more than happy to assist you. I'll now introduce Dr. David Taylor. He's our medical director for Bozeman Health Clinical Research. Dr. Taylor is going to share some information about COVID variant sequencing, a project he has been collaborating on with MSU and with Dr. Blake Wiedenheft. So I'll still stay on and be available for questions, but I will turn it over to them. Lori, if you're okay with that at this point. Okay, great.
Okay, I'll share my screen here. So I'm going to give an update on the COVID variants in Gallatin County. So this is a little bit of just comparing the US, Montana, and Gallatin County, and you can see this is the entire length of the COVID outbreak, and there's been this massive increase in the late December, January period here, both in the US overall, with in some days here, over 1 million cases have been reported. And in Montana, it's similar, although not quite the same sharp peak. But when you look at Gallatin County down below here, you can see that it's very similar to the US shape, where the current wave of infection is really completely outshining the Delta, which is this bump here in the curve. So Gallatin County, which is here, is one of the hot spots for this wave of this current wave that we're in, compared to other counties in Montana. So the big change for us locally here is that we've have these long lines of cars that are queuing up to go to Lot H, where there's the testing facility set up. And so that began in early January when we saw this. And so this goes along with what Kallie was mentioning, was there's been this major increase in the number of tests that were done, much more than we saw in previous waves, with over 5,000 tests here in recent weeks. And the percent positivity has also risen from down around 10% to over 40%. So Bozeman Health began a collaboration with Blake Wiedenhoff in the Department of Microbiology and Cell Biology at MSU in December to identify the COVID variants. We're very grateful to Karen Hicks and our clinical pathology department for providing the specimens, and Silas Smith in our department was involved in preparing the specimens for MSU, and Aidan McVeigh and Helen Lee at MSU provided all the assistance for the actual sequencing. After the sequences are found, MSU posts these genomic sequences from the study to the GSAD website, which is a website that provides globally open access to genomic data on COVID-19 and influenza strains. The variant results are also provided to Gallatin County Health Department for follow-up and contact tracing. So this is sort of the meat of the slide here. The first column shows the increase in the number of tests, going threefold from 1,500 to over 5,000 here, and 4895 most recently. The percent positivity rose almost 15-fold from 132 positive to 2,000 positives here. And you can see the percent positivity going from a range of around 7 or 8% to now 41%. So we looked for Delta, Omicron, and other variants, and I'm highlighting here the Omicron variant. So when we first started our collaboration in mid-December, Omicron accounted for 14% of 21 specimens tested. The next week, it was up to 69% of 45 specimens tested. The week after that, the first part of January, it was 95% of 39 specimens, and then 100% in the week of January 8th, our latest data. So in a period of less than 30 days, Omicron has completely replaced the Delta variant in our community. So that attests to the rapid transmission of this variant in our community, completely replacing Delta in such a short period of time. So this is just another way to look at this. These blue bars are the Omicron proportion compared to Delta, which is in orange. And you can see that over this period of 4 weeks, that Omicron has completely replaced Delta. This goes along with the national findings. This is from the CDC website. The purple bars here look at the United States overall, showing that by the 8th of January, more than 98% of the strains were Omicron. In our Western region, here to the right, it's a little bit less, about 95% are due to Omicron. So we did a little bit of digging on the demographics, in our study. And so this is from the week of December 25th. This is where we had a split between Omicron and Delta, 29 Omicron cases and 11 Delta. And one thing that we noted was that there was an age drop, so that the average age for Omicron infections was 39 years compared to 49 for Delta. The other thing that was of interest was that a Montana address was only given for about 2/3 of the people that had Omicron, the rest being out of state, compared to 11 out of 11 who had Delta gave a Montana address. So sort of indicating the endemicity of Delta, and perhaps as many as 1/3 of the people with Omicron had acquired their infection outside of Montana and then were detected here in Montana. So there really wasn't much of a difference between Omicron and Delta in terms of gender. I just also wanted to mention that, in our subsequent groups, where in early January, the ages still remained fairly consistent, about 39 or 40 years of age, with a broad age range. But now almost all of the cases are Montana addresses. So that one transition period, we saw more out-of-state people, but now it's clearly endemic, and we're seeing it here. The only other, just in terms of a conclusion here, so by January 2022, the Omicron variant has completely replaced the Delta, and among the COVID infections that we tested in the Bozeman Health System, there was a decrease in the average age, and then made the point about the transition and the out-of-state addresses. And so we're going to continue monitoring for COVID variants to see if Omicron continues to be the predominant, or whether some other variant might come in. Despite this big spike in the number of cases, there has not been an increase or a really significant increase in the number of admissions. So this slide, what I've done is look at the total number of COVID admissions for 2-week intervals beginning in November, and showing that it was somewhere in the 35 to 40 range prior to this Omicron outbreak, and it's only really gone up to about 47. So at most a sort of 50% increase in the number, despite this massive number of increase in cases. So again, attesting to a relatively mild disease compared to the Delta, but highly transmissible. So that's, I think, everything that I need to say about our study so far. Thanks to Blake for helping us out here. We really appreciate that.
Great, thanks, Dr. Taylor. Do you mind stopping screen share?
Sure.
Thank you.
How do I do that? There we go.
Excellent. All right, I'll turn it over to MSU to see if there are any updates from MSU that you'd like to share before we open up for questions.
I don't think I have too much to add to Dr. Taylor's summary. Maybe I'll just add a little bit of a side note from what we've been doing in addition to sequencing patient samples provided from Bozeman Health. We've also been sequencing samples, archived samples that were provided from the state from a larger screen of samples taken around the state. And we also monitor the wastewater for not only the abundance of SARS coronavirus in wastewater, but also the concentration of different variants. And consistent with the data that Dr. Taylor just showed, the last time that we were able to detect the Delta variant in Bozeman wastewater was December 21st. And since then, the Delta variant's been completely taken over by Omicron. I'm happy to answer any other questions if there are.
Thank you, Dr. Wiedenhoff. Michael Becker, do you have any updates from MSU?
I'll just add that we opened for classes at MSU this week. Wednesday was the first day of the spring semester. With the return to classes, our campus symptomatic student testing center returned to full hours and has been seeing an increase in the number of students. Obviously, they are back in its full strength now, so we are testing. Our faculty and staff who are covered under the university's insurance, as well as their dependents, thanks to a partnership with Bozeman Health, can seek symptomatic COVID testing at the Bozeman Athletic Complex Clinic. So that is an option that is also available for the campus community. The university continues to offer vaccinations of all doses at our site in the Student Union building, and that is through University Health Partners, and that is open for faculty, students, and staff.
Thank you. All right, with that, we'll open it up to air for all of you for any questions.
I have a quick one. This could be, I think, for you, Lori, or with the wastewater, I guess, has wastewater also kind of matched the trend that cases are seeing? Like, are we seeing a decrease of COVID in wastewater? How's that looking?
I actually might turn that over to Dr. Wiedenhoff to speak a little bit too, if you feel comfortable kicking off, and then I can add any additional information as well.
You bet. All this data is made publicly available on the Gallatin County Health Department's website, and you can get it in real time. I'm just going to peek at the website here myself right now before I say something that's inaccurate. There's a little bit of a caveat here in answering your question. So what we've shown since we started doing wastewater testing since March of 2020 is that wastewater is a real-time indicator of trends in the community that gives real-time information of what's to come. And what I mean by that is we get some predictive power by monitoring wastewater because people start shedding the virus before they're symptomatic. And it also picks up virus, of course, from the community, regardless of healthcare seeking behavior or all sorts of things like that, or asymptomatic individuals that are shedding the virus and so on. One of the things that we noticed is that through regular testing of wastewater, we get advanced warning of coming surges in the community. And that trend continues to be true, but there is a caveat here, and that is that once the concentrations in the wastewater get above a certain threshold, it no longer becomes quantitative, it's just qualitative. What I mean by that is we can say that there's a maximum amount of SARS coronavirus that we're able to detect, but we can no longer give accurate estimates of how much virus that is. So if you look at the data where we superimpose the wastewater quantitation data on top of the case count data that's coming from the county health department, you can see that the numbers from the case count data continue to go up while the quantitative PCR data just maxes out and then kind of plateaus. I hope I answered your question, but ask again if I.
That was awesome. Thank you.
Thank you. Any other questions out there?
Hi, everyone. This is Juliana from the Chronicle. I had a couple of questions. Lori, my first question is for you, I think. I was going to ask if you've gotten any word from DPHHS about those at-home test kits, how many the county might get and when they could get here.
Yeah, thanks, Juliana. So we just recently heard from DPHHS in terms of the allocation of the at-home test kits that the governor's office, DPHHS, has procured. We will be receiving a little over 22,000 test kits. So again, those come in packs of 2 tests per box. And in terms of ETA, in terms of when that may be landing to the county, we don't have a really great timeline just yet. We understand that they, barring any challenges with transportation, should be coming to DPHHS early next week. And then it will take a little bit of time for those to be distributed and allocated across the state. So that's the best I can share in terms of timeline. So we're hopeful that in the next coming weeks, we'll have those ready to distribute.
Cool. Is that coming all in one big chunk?
We are requesting the entire allocation.
Cool. And just to clarify, you said 22,000?
A little over 22,000 test kits.
Okay. Cool. That sounded like a lot, so I had to double check. Awesome. Thank you. And then I had another question. I think it would probably be for Dr. Taylor. I'm kind of curious, since our COVID graph kind of follows the US. Well, I don't know if that's related, but if you're able to kind of tell with this when cases may peak here in Bozeman, or if you looked at any kind of modeling for when we might see a Omicron peak.
Well, I think Lori's data spoke to that probably best. It's the most accurate. And what she was saying was that although the number of cases are going down, that it's too early to declare victory at this point. In other words, we just don't have enough data to really say with certainty that the outbreak is decreasing. There are a number of places in the United States, primarily the East Coast, where there does seem to be a definite decrease in cases. And so we may well be seeing that here in Montana as well. I think we just need a little more time to definitively declare that.
And I thank you, Dr. Taylor. I appreciate that. And the only thing I would add to that, and just stress again that we are experiencing the highest number of cases, active cases, that we've seen and throughout the course of this pandemic. So again, we just need to be really diligent and understanding that there is a lot of active disease circulating in our community.
Awesome. And then I guess a follow-up question would just be, at this point, do you think that hospitalizations will stay at this lower level in proportion to case counts, as you kind of already saw in your data?
Yes, I think it will. Our census is lower, continues to be lower than it was during the height of the Delta wave. During the height, there were approximately 30 beds full, and I believe that Kallie just mentioned that we're about 15 to 20 right now. So I think that that will remain consistent. I don't see that changing. So there's been, I think, a slight increase in hospitalizations, but also on the other side of that, I think that the length of stay during the Omicron period is shorter. So people are coming in and being discharged, and that's what's keeping that census down to the 15 to 20 patients at any one time.
Thank you.
Other questions?
I have one.
Hi, I have one. It would be Gus Yeager. I'm from the Exponent, the student paper here. This would just be for anyone, if anyone has any information, but should we expect any closures coming up or a transition back to the kind of remote world we had a couple years ago, or can we is it fair to assume that we'll keep having in-person events?
Gus, I can address that from the university's point of view, if you like. You know, it's the statement's pretty simple. The university is committed to in-person classes and continuing in-person events this semester. That's why we have put in place measures such as required face masks in all indoor buildings to help minimize the spread of COVID-19, and why we encourage students, faculty, and staff to monitor themselves regularly for symptoms, stay away when they're sick, and see their medical health professionals as needed, and of course to get vaccinated. We want to make sure as many people keep this disease to themselves if they get it, and keep themselves from getting it in the first place.
Awesome. Thank you. I appreciate it.
Hannah, you had a question. Go ahead.
Yes, thank you. This is Hannah Kearse, NBC Montana. I just wanted to ask, and y'all touched on it a little bit already, but with Omicron taking, so quickly over as being the main transmitted variant in Gallatin County, are there any other implications that relates to? I know it, obviously it's high transmission, and lower hospitalizations because of the quick turnaround. But anything else that y'all think is worth noting? I just wanted to check.
I'll take that if it's okay. There are some treatment implications that are important. The most important probably is the treatment with the monoclonal antibodies, the ones that were used most often, made by Regeneron and also Lilly, don't appear to have much activity against the Omicron strain. And so another monoclonal called Sotrovimab is made by GSK and in collaboration with a biotech company called Vir, and that one is supposed to have the most activity. Unfortunately, that's not very readily available in our community. But at any rate, that I think that we've seen a decrease in the use of the original monoclonal antibodies at this point, and are reserving at this point the cases that are relatively severe that would need a monoclonal antibody to try and use this or not at all. The other new modalities are the two oral drugs that are becoming available. They're still, I think, in short supply, but they may have an impact on cases that become severe. The main aspect of this is that for the vast majority of cases, they're being really treated like severe colds or flu cases where no specific therapy is really required.
And maybe the only thing I would add to that, Hannah, is that, obviously with the higher transmission, and Kallie kind of touched on this a little bit as well, it is definitely causing a lot more individuals who need to stay home in isolation or in quarantine, which is impacting sort of some of our healthcare system as well in terms of staffing resources and other industries across Gallatin County and across the nation in terms of the impact of something that's much more transmissible. And it certainly is definitely not a variant, and I think Dr. Taylor may agree with this as well. It's not necessarily a variant that should be underestimated just because of that high transmissibility and the fact that there are individuals who may experience the disease process differently than others. So I just think it's important for us to understand that shouldn't be underestimating this particular variant, as well as just understanding some of the impacts, social impacts, as well as we talked about staffing and other resource impacts as well.
Thank you all so much.
All right, any other questions? I don't know if we got to everyone. We did.
I had one more really quick question.
Please.
I remember last week, I think you were saying you were a bit behind in logging cases with the huge rise in cases. I'm wondering if you've gotten up to date with that or if it's still kind of behind.
Yeah, great question. Thank you for that. We have an amazing staff here, and really they just worked very hard to get us up to date as best as we can in terms of entering those cases in. So we are definitely still prioritizing our case investigations and contact tracing efforts. But in terms of those data that we are able to share with all of you, those definitely have, we've been able to keep up with that a lot better than we did last week.
Cool, thank you.
Yep, thank you. All right. Well, if there are no other questions, I just want to extend a thank you to our guests today. A thank you to our guests today. It was great to have the additional experts in the room to speak to this. You really just added a lot of value to the conversation. So I appreciate your work and I appreciate you bringing your perspectives and your knowledge to this group, and then also those who are listening in afterwards. So thank you again, and we'll see all of you next week. Have a good one. Be safe.